Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. And today I am super excited to have an amazing dentist with us, Dr. Bryan Tiek from Carmel, Indiana. Thank you so much for being on the podcast.
You are welcome, my friend. My honor to be here.
Well, we were talking a little bit before recording this that what's so cool about you, and you have a podcast called Teeth Talk Radio that you talk like the viewpoint of your podcast is different than this one, where we're talking about the patient's perspective. And really we've had a couple patients on, but it's primarily Dave providing the patient perspective, where you actually are talking directly to patients on Teeth Talk, correct?
Absolutely.
It's cool. It's neat. It's out of the box thinking of a dentist talking to patients. What was the motivation for you to start a podcast talking to patients?
Well, kind of twofold. I as a dental professional myself, I digest an awful lot of podcasts just personally. I love learning that way. A lot of all of our colleagues, and I say this to most people. Most dental podcasts are dentist to dentist. We learn a lot from each other, encourage each other that way. Within the industry of dentistry, it's so clouded and so messy a lot, and so confusing to a lot of us. We can learn an awful lot from each other. So I'm a fan of the podcast forum. I think it's a great medium for us to learn. But I'm also a music and tech junkie, and so I've had a studio attached to my office for years, and I've used it for actually music recording. But I had the crazy idea, it was obviously not a crazy idea, but just thought, why not use this space for something other than just music, and why not use this for podcasting, for something that can benefit and educate, my patients, who, I talk to on a daily basis. We, as most of us, all dentists can agree to, we find ourselves saying the same thing many times a day, many days over. And I thought, why not, use this as an opportunity to address common questions, address common problems and things that people are interested in, perhaps, and it's a kind of a thin line, because the majority of public's, not going to be immediately just super duper excited to hear and my wife would be the first one to tell you, it's like, really, people want to listen to someone talk about teeth?
Your wife is like, they want to listen to you talk about
exactly.
That's what my wife would probably say too.
And she's a safe zone, so she can say that. But it's true though. How can you make it entertaining? How can you make it to where someone might want to listen? And so I tested it out last year. Just did a couple episodes just to see if people would take to it, and actually had a good number of patients come back and give me some feedback saying, "Oh, this is kind of cool, because I've always wanted to learn about ABC or XYZ or questions I've had," and so that's where it was born. I think really started fast forwarding about a month ago, when all of our lives were turned upside down in terms of just our daily practice, shutting down the world of dentistry here temporarily. Really, shock to the system for most people, and most dentists, myself included. But at the same time, really was a spur to me to say, hey, why don't you think outside the box? Why don't you really start focusing on some different things in the world of dentistry? And so I really got laser focused on some new things and new things that I wanted to try, but this podcast being one of them. And I've had a ball with it. It's been really fun. It gives me something to do, get out of the house for just a little bit. I don't have to really worry about social distancing. I'm sitting here in my studio all by myself, but really be able to have fun with it and educate patients.
Yeah, it's great. I started podcasting because I met somebody at a tech conference who was starting a studio, and I'm a sucker for anybody starting a business. I'm like, oh, you need someone to do a podcast, I'll do one. And and so then it kind of has snowballed and focusing on the patient perspective. And it's interesting that you're speaking directly to patients. And a couple interesting things. Number one is we set this up before COVID-19, so it's neat that you, before we sent this up, you probably weren't as focused on your podcast as you are now. So that's kind of neat. And then also, the the focus on the patient's experience is very much in line kind of what we do. And yesterday I found out that our podcast was trending in the UK. So it was like moved up, and I have no idea why. Hello, all our friends in the UK. That's amazing. But then I looked at the reviews, and the reviews were very nice. Lots of them saying, thanks for keeping it so short, which I think that's good. but they were all by patients. And I'm kind of like thinking like you, like, in my mind, we're always speaking to other dental professionals on this podcast. Sure. But patients are using it to learn about dentistry. And frankly, I think that when we speak about dentistry on this podcast, we're talking I would have assumed that it would have been in a language that would turn off other patients, but the opposite is actually true. A lot of patients are listening in, which is, I'd love to have it. It's great. It's fantastic. So kudos to you to have a podcast speaking directly to patients. I've been overwhelmed with how much this podcast has sort of helped move things for me in my practice and my career. And it's funny, when I started, I was kind of like, there's so many dental podcasts, who needs another one? And I think everybody gets their own audience and has their own viewpoint, and the more the merrier. So I think it's great, particularly, think about your patients listening to your own podcast, that those constant touch points, understanding your philosophy, figuring out where you actually come from. It's very strong. And I would encourage other dentists to do the same. I love music too. I sold guitars when I met my wife, and we met in a music store. And so I didn't know that about you before. So what kind of music do you play?
Well, I've actually used to tour in a Southern gospel group. We actually did on the weekends, and it was a lot easier before my wife and I had children. But I'd work through the week here in the office, and then we'd go sing on the weekends, just festivals, churches, fairs, and whatnot. Absolutely loved it. But we've got 4 kids now, and my weekend time is pretty special. And actually, right now, this whole this at-home season, I'll call it, has been so nice. To be home with the kids and everything being on hold. Is very healthy if you allow it to be, obviously for family time. But yeah, I used to tour, used to do an awful lot of that, but it's I always say to folks, your life is just seasons, just appreciating different seasons of what you do, and just making the most of it, no matter what it is you find yourself getting into. Again, don't be afraid to think outside the box. I'm talking to other dentists here specifically. Don't be afraid to think outside the box. See what you can do to not only, I would say maybe just expand your abilities and your careers, but to kind of go back on what you were touching on. My first podcast episode was just called Don't Be Afraid. One of the most, probably biggest hurdle most dentists run into with just patients and dealing with the general public is people are afraid. They're afraid to come. And I always kind of giggle at the fact, like, if you see me in person, I don't know who in the world would decide to be afraid of me. I don't feel like I'm that fearful looking. But at the same time, that's a big hurdle. And I think if there's a way that, and I want to really kind of use my podcast with an overarching theme of just relating to my patients and relating to people. You don't have to be a patient of mine to I want to relate to you. I want to kind of break down any kind of barriers that are keeping you from not only dental health, but just overall health, and just a place where you can live a better life and you can live a more fulfilling life. This whole podcast, maybe it's called Teeth Talk Radio, but it's a lot bigger than teeth. It's a lot bigger than just talking about your smile. It's things that make you smile. It's things that can really improve your life. That's what I really, really want to drive home.
That's great. That's fantastic. And I have to mention, because you're I think you're one of the very first Opera users you brought on when there was just the intra-office communication system chat. And so you don't just think outside the box when it comes to your podcast. You are an early adopter. Would you call yourself an early adopter of technology, or just an early adopter of Opera?
Well, sure. I mean, I don't always jump on every new trend that comes out, but when it comes to technology, man, I'm all over it, because I love seeing what you can do. I've been an Apple fan my whole life. Obviously used Mac in my studio. I'm a Mac junkie, but had an Apple Watch since it came out, and noticed, and that was really, I'll just say, specifically, full transparency, that's what drove me to the Opera DDS platform when you first had chat. So like, oh, this is sweet, because I can use it drives me crazy. I came from a culture, at least in an office. I was right out of dental school. We had a really interesting technique. The hygienist would just, and some other dentists may relate to it, but when a hygienist was needing a hygiene check, they'd come in, and instead of the old timey way of interrupting you, hey, I'm ready in one, hey, ready in two, they would just slap this wooden, almost like a coin, down on the table behind you. And boy, it just would it would scare me to death. I'd be sitting here working, and I'm so focused on what I'm doing, and you hear this smack behind you. And
like the fuga de chow, where you think, like, I'm ready for more beef
in a fierce way, demanding the meat come. But yeah, it was. That was almost 20 years ago, and I remember thinking, even that far back, man, there's got to be better ways of doing this. And we've all had and known about the walkie-talkie type. You can have the stuff on your computer. But when you guys came out with the Opera platform, I thought, oh, this is so nice, because it's subtle. It was so simple. I just get a notification on my watch. I can sit here and read what the hygienist or someone else in the office is needing. So yeah, man, I jumped on it. I thought it was great. And then to see, I think now, and I'll just, not to make you inflated or anything, but I'm a fanboy of what you guys are doing, because it's so far beyond just that. Like, all of the things that you guys have been adding over the years, and especially what you have now, the whole Opera DDS platform is just fabulous. It's great. Forms are fantastic. We can send to patients just that quickly right to their. I love being able to do this. Say a patient sitting in a chair and they need a consent form for a procedure we're doing. Just immediately send it from the computer right to their phone. They sign it on their phone. It's right back in our system within seconds. That is awesome, and it's just a great. There's a wow factor to it, and a lot of practice management guys and gals refer to this a lot. But the wow factor for patients, and what that really does is the simplicity, but it's amazing. I mean, it's so cool. It's not like you really have to do much work, but really make a huge and a big impression on your patients. It's fun. I think you guys have created some amazing stuff. So
thanks.
Keep going.
Well, I appreciate it. Well, we are. We're talking. There's some big stuff coming next week, which I think I won't talk about it now, but we'll do a podcast on that later.
Ooh, a teaser.
Yeah, that's true. We're always coming up with, as you know, we're always coming up with cool stuff, I think. But right now, I think it's important. I want to just make a point, because I've been talking with a lot of dentists right now, that with paperless forms, I think it's more than really cool right now, because getting rid of cross-contamination, and who knows what things are going to look like in a couple months. But as much as we can reduce, like you talked about, sending things to patients' phones right now is crucial, because I mean, I went to get a hamburger the other day, and they had two different cups, one for the pens that you use to sign, and then where you drop them so that they can sterilize the pens. So I mean, there's people freaking out on Facebook about having to sign a receipt at Target. And so, I mean, I think in our office, and that's no joke. We're going to be, we're going to be having to reassure our patients for quite a while now. And I think your podcast, Teeth Talk Radio, you can get that message out in many different ways. I like to say that people want to consume information different ways. So if you have a newsletter, you have a podcast, you social media, kudos to you, man, for doing that. I think it's fantastic. So I appreciate it.
But man, that's very kind of you. We'll keep going.
Cool. Well, thank you very much for being on the podcast. I appreciate it.
Well, I'm more than honored. And just hello to everybody out there in the dental world. And just let's keep going. Let's keep thinking outside the box. Let's do what we can. And things are going to look a little different, here hopefully sooner than later. But don't be afraid to try new things. And and I'll say, check out opera stuff, man. If you don't have that on your list of things to look at, put it on your list of things to look at. Because if you try it out, you're going to love it.
Well, thank you, sir. And if you can look at opera and then you can listen to Teeth Talk Radio. Appreciate it.
You bet. That's it. You got it, man.
Thanks, man.
No problem. Enjoy.